Do you feel what you do matters?
You know, that is something that I think about a lot. Like, am I making a difference? Like the reason why I went into physical therapy is because I wanted to impact people.
There's days in healthcare that are really challenging. At the end of the day, you can beat yourself up over the things you've gone through. You can have regrets. You can wish you have done things differently.
You are by nature sort of a fix-it person as a clinician. You want to help and you want to make it all better for them.
It's frustrating sometimes when the outcome you want out of a patient, you don't get.
I would love to have a full hour of one-on-one time with each one of my patients. Unfortunately, logistically, that's just impossible.
I feel like there's so much to get done in so little time.
It's a struggle sometimes when you're trying to motivate somebody that, isn't as receptive and, trying to find that way to reach that person.
We see a lot of really hard things. We see people going through some of the toughest points in their lives.
The worst part is probably not being able to be a miracle worker.
You're their shoulder to cry on, you're their strength when they don't have any. You're that sounding board for days when they just feel like they can't get through it. And you become just the light at the end of the tunnel for them, and you kind of make it through this process together.
I was playing high school hockey, varsity my senior year, and on January 4th I got checked from behind, went headfirst into the boards and fractured my C5 vertebrae, leaving me paralyzed from basically the neck down.
I was in pain. It almost felt like when you hit your crazy bone, but it was up here in my shoulder.
It was really anxious to get going, to be able to learn how to walk again.
I was in ICU for a couple weeks. I don't remember any of that whatsoever.
He didn't know his name. He didn't know us. He couldn't ask for anything. He couldn't walk. He couldn't talk. Nothing. And they brought him out of it.
We just kept focusing on what's your goal and let's get you there. And that's the biggest part of it.
They always gave you security that it's okay, that it's not unusual, what you're going through is normal, and they would just calm my fears, just talking to me.
And I never lift my head up because I didn't want them to see me cry. And Joe would just come by and rub my shoulders, and he said, just take it easy. Like they just care. Like I said, I just adopted a family outside of an injury.
Any given day, this guy's flying around. I mean, he's working with this person, that person. He's working hard. It's really, just to see how hard he's working, it makes me want to work a little harder myself. It's kind of an inspiration, it really is.
It's like I want to work harder for him, as well as myself, but I also want to work harder for him to know that what he's doing matters, what he's doing counts, what he's doing is actually helping someone.
I loved her. She would hold my hands. That's another thing. She'd hold my hands. She'd go, come on, Rose, you can do it. Come on, Rose, you can do it. And I did it.
I felt myself getting better each day.
These are people who are there to take care of people who can't care for themselves in some of the most fundamental ways. And they do it patient after patient after patient and day after day after day.
They go so far and beyond what they're supposed to do. They gave us faith. They gave us hope.
She's like my guardian angel. I feel that God sent her to me at a time when I needed an angel.
There's no book on it. There's no way to figure it out. You just get up every day and put one foot in front of the other and just go. And if it wasn't for them helping us push us along, we would have never made it.
My vision for the future, it may not seem realistic to anyone else, but it does to me, because I really would like to see a world without wheelchairs, and this is what I'm working towards. I'm not going to stop fighting this fight.
Because I just won't accept the word can't now. And I think I owe a lot of that to working with Tyler and the other therapists down there.
I knew that they were going to get me through this, and they have.
I have a son that constantly reminds me of that first week when I came out of surgery. He just said something to me last week. He said, you know, I can't believe how far you've come.
They helped me immensely. They did a great job. You know, I can't say how much they did.
I mean, it helped me get my life back.
There are dark days when you get hurt, and there are dark days, I guess, for lots of other people with lots of other problems. Being around positive people makes a big difference.
I don't know how to say thank you. And there's not enough words to say thank you for what they've done for me.
It was a long fight, and the people that tended to me, I have the utmost respect for.
I would say thanks for giving me my mom back. But also that they really have an impact on people's lives. And I know that it's hard to see because they're in the trenches there and they're, you know, doing the literally dirty work. But those caring hands and caring thoughts, and it just, I can't tell you the difference you've made in this person's life.
There's no way you could ever repay somebody for what they did for us, our son and our whole family. And I love them all.
There's really dark days and there's hard days, and we're there for those days, and we're helping them through those days. And now to come on the other side and to see this, it makes everything else that you went through so much more worth it.
You are changing people's lives more than I would have ever thought.
I feel like privileged or like honored that I got to know some of these people and that I got to work with them and that I hopefully have helped them in some way.
It's taking it from an account perspective to a patient perspective and seeing it as a person that I'm handling.
Even though we're in the billing department or the auditing department, no matter what department you're in, we're helping them.
Makes me feel great to be a part of such a great company, to do something to help people to get their lives back to or as close as possible to what it used to be.
I mean, you know you help people. You know that you go to work knowing you have a plan in mind and what you're going to do with that patient that day, but we're not above hearing thank you and just hearing like, yeah, everything that you did with me, it brought me to where I am.
And just seeing the difference, both emotional and physical, in these people's lives, it's wonderful.
Physical therapy is a calling for me, and hearing stories like this just reassures me that like this is what, you know, I'm called to do.
It's what you hope for. It's you hope that people do feel impacted and do feel better and do feel like physical therapy made a difference.
With any job, you start to go through the motions sometimes, and then when you have the success stories, or you have somebody express some appreciation, or tell you about something that changed in their life because of what we were working on together, it gives you an aha moment again, and this is what I'm here for.
To see them relax and be able to sit back and reflect on how emotional the experience really was, and how big of a role we all played as a team together, it's nice to hear.
If you can be that shred of happiness in probably the darkest time of their entire life, it's pretty special.
We do make a difference. You know, we do matter. What we do for individuals is important.
That's the hope that gets me out of bed each day. That's the hope that takes me into work, that we can provide an outcome like this for somebody, that we can help them through a devastating situation to get back to life with their family and their loved ones. Feels really good.